Well, there's certainly a lot going on. It's always an incredibly exciting Congress, and I'm really pleased about this spotlight, which is on the environment and the heart, because we've got more research coming out about the detrimental effects of pollution, and even pollution below our accepted standards. So that's very exciting to do that. And then the ESC is going to be focusing on the environment and on trying to change policy. But it's not just about well, which is always difficult, but it's not just about the individual. So it is about creating healthy environments, not only around air pollution, but also making sure that people have access to fruits and vegetables, that our cities are safe for walking and cycling, and those kinds of things, because we do have a problem with rising obesity levels, diabetes, and things like that, which could negate the gains we've seen in cardiovascular mortality. I think you have to take small steps, but we also have to legislate for policy changes, for holding people to agreements around clean air, because it's going to cost us. Of course, it costs a lot to change from fossil fuels and to clean up the air, but it certainly does cost us a lot in health care and in loss of human productivity and life. I think it's a global problem. And even in Tasmania, there's an abstract that's been presented from that, which generally has fairly clean air, but they can show that there is an effect when air pollution levels do rise. I think that all of them can get benefit, certainly. You find that nurses will go to a variety of sessions. We do have sessions that are specifically developed by the Nursing Council that are specifically aimed at nurses. But we also participate in sessions that are very much multi-professional, or you may go to a session that's primarily medicine, but because it's a topic that you're interested in. So I think they can get a lot out of it. I hope that they will, well, several things. First of all, that they hear the latest research, they get inspired about new findings, and they wonder how that maybe can be implemented into practice or what implications it has for practice. Secondly, I think it's the networking, it's the energy that you get from being here. And if you are an aspiring researcher, being able to interact with senior nurse researchers here, so there is that networking and collaboration, and I think it gets people excited about the role and about interaction, sharing knowledge across countries, because it really is an international meeting. I think it's more focused because you're all here for the same reason, and you've stepped outside the usual constraints of your work or your life, and so you may be more open to having that initial conversation. And I think sometimes the face-to-face interaction makes it easier than to pick up the telephone or to email someone.